The Honourable Dr Brian Walker.
Thank you, Deputy Chair. A number of questions to be asked at the moment, but one thought has struck my mind. It's been mentioned a number of times so far in this part of the debate. You've mentioned a couple of times that you can challenge the decisions at the SAT. And I'm wondering, how much would a challenge cost at the SAT?
Minister. Thank you. We'd have to find that out for you, Honourable Member. I don't have it in front of us.
The Honourable Dr Brian Walker.
Thank you, Deputy Chair. If that could be found, I'd be very grateful. It's just my curiosity there, because, of course, the more there's a financial cost, it might even be free, the more the trouble, the more the people are going to be unable to pursue their path for perceived justice. But my questions will start now, actually. In the Law Reform Commission...
Nonetheless, ask another.
Well, I've got to practice. Thank you for your kindness, but I must practice as well. The Law Reform Commission, their report, I've been through it in some detail, actually, and listened to what read of what the Minister had said about most of it being adopted. Is it, my understanding is that the shooting community was mostly very much in favour of the Law Reform Commission report. Can you confirm that?
Minister.
Remember, I can't say that with any level of certainty. Certainly, various people provided submissions as part of the Law Reform Commission inquiry. I think there was 1,244 submissions. I can't say that they were generally supportive or not.
The Honourable Dr Brian Walker.
Thank you, Minister. The conversations I've had with the various groups, the shooting groups and the people who have actually been in consult with me, have generally said they were quite in favour of that. And I looked at the number of the recommendations by the Law Reform Commission, and that 93% I calculated actually had been implemented. So the question arose in my mind, if there's such a lot of disagreement with the current legislation, what has been added to the legislation that would upset the shooters so much?
Minister.
Thanks very much. So certainly some issues have been raised, concerns raised in relation to the gun limits, in relation to health assessments, albeit health assessments could be required under the existing legislation. Training, some complaints were received in relation to property letters, and some even complained about new storage requirements.
Dr Brian Walker.
Thank you, Minister. We also heard earlier on, I was fascinated by this, that there's one aspect there. I think the Waypol lawyer had given some opinion, clarified, I think, so there's specific wording. So that was really, I find that very interesting and very proper as well, because the correct advice is being given by people who are actually educated and knowledgeable in this area. My question is, are there any other areas specifically that such advice has been given independent of what the government itself has put out?
Minister.
Thanks very much. Honourable Member, I might ask you to ask that question again. I didn't understand the question, so perhaps for my simple mind, if you don't mind kind of breaking it down a little bit further for me.
The Honourable Dr Brian Walker.
Thank you for assuming a simple mind. I'm assuming it's not. It's my wording, I'm sure. The question is that in this particular area, I think it was actually regarding the number of weapons, that there's specific legal advice from a Waypol lawyer, which is very right and proper. I was wondering, are there any areas designated where a Waypol lawyer has specifically contributed to aspects of this bill? It might not have been noted, of course, but...
Minister.
If I can clarify, Honourable Member, so when I spoke earlier on about lawyers or police lawyers, that was in relation to the letters that have been sent out this week. In relation to the drafting of the bill, well, of course, I mean, that was done in-house. The consultation was happened by... And various people in the police, in WA Police were involved in that, not necessarily external lawyers.
The Honourable Dr Brian Walker.
Again, thank you, Minister. All very clear. You mentioned earlier on, this is my specific interest, of course, is the medical approaches to defining who is a fit and proper person. And I was wondering, now, speaking here as a general practitioner who is likely required in the not too distant future to be personally involved in determining that, Can you give me a precise understanding of what you actually are looking, what points medically, not mentally, medically would make this person improper person to actually hold a firearms licence?
The Honourable
Thanks.
The Minister.
Thank you. So I'm told at the moment, in certain circumstances, doctors are used in relation to driving licences. And so doctors make an assessment as to whether it's appropriate for a person, particularly a person of senior years, it's appropriate for them to still hold on to a licence. So it would be a similar process in relation to a gun licence. However, in terms of the guidance, WA Police are working with the Royal Australian College of General Practice, also the College of Psychiatry, WA Country Health Services, the Primary Health Alliance Network, to work out exactly what the guidance will be given to doctors. The intention is that it aligns with the kind of assessment that's done. It would be a similar type of assessment to one that's done for an aged person in terms of them keeping their licence.
The Honourable Dr Brian Walker.
Thank you, Minister. Just one question before I pass. I've got a few more after that as well. When it comes to doing a driving licence examination, I get a form there, which has got a number of pages. The nursing staff will do some part of that. I will do the major part of that. And it's come often in my personal experience that I'll go through the boxes and see the eyesight is there, the blood pressure is there, the diabetes is under control, and I look at this person and I say to myself, if my wife and children were coming the other way, I wouldn't want him to have a licence going that way. And so it's not actually, it's a sense I have there that there's something not quite right, and I'll send them on to a specialist to be tested again. It's generally going to be about things like cognition, or indeed some mental health issue there as well. Anything, if my wife is going to be in danger, I don't see why I should allow anyone else's wife to be in danger as well. And so that's the standard by which I go. Is that a reasonable approach to take with the firearms licence?
Minister.
Oh, that is the approach, and that's the type of outcome that medical practitioners will be able to provide. And obviously, as I mentioned earlier on, I guess the data stays with you, so it's only essentially the message that goes to WA Police as to whether the person you'd think the person is an appropriate person or not.
The Honourable Ben Dawkins.